I think COVID has really sorted out how organizations are capable of making quick changes. And I, I've been thinking about a village a friend of mine lives in, where the village pub, when it was locked down, turned into a real centre for the village. It took deliveries. It started producing meals, and so that pub, unlike most village pubs, has made a huge success of COVID, and it's changed the whole way the village feel about itself and the village feel about the pub. Uh, and I think most organizations haven't got the flexibility to think quickly and make accurate predictions. But my goodness, Toby and Maggie and their team have certainly done that. And they got straight on to the fact that they weren't organizing a huge conference in London with a multidisciplinary conference, which is a terrific undertaking. They suddenly chopped that and gone, as Anne said, for for webinars, for working online, and I think we've been really lucky to be part of that, and it's working, and it will drag in uh, healthcare professionals who are desperate for education.
Yeah, I think it's particularly difficult for people who have had a structure in their life that they've managed their diabetes around. So so if they can no longer access clinics and no longer have the same structure to their daily life, it can be very difficult to maintain whatever they put in place to help manage their diabetes. You particularly think of meals and eating. And I don't know about other people, but I've found that in lockdown, meals have become very important. And you sort of almost go from having breakfast to thinking, now what shall I have for lunch and what shall I have for dinner? And so food becomes the focus of the day. And for somebody who's overweight, who's trying very hard to restrict what their food intake is, I think that having the focus on meal times is really difficult. And of course, when we know very well when you're bored, you tend to go for a bit of this or a bit of that to nibble. So I think having the lockdown has probably made it very difficult for a lot of people with diabetes. And of course, exercise as well. You know, you not only does it get you out of routine, but actually there's maybe a disincentive to go out because there were actually restrictions on what exercise you should do, and you certainly couldn't go to the gym, for example. So I think it's had a big impact. The only thing I'd say in relation to type 1 diabetes is that some of the people I've spoken to have found it helpful because when they are at home all the time and they are having meal times at fixed times, they actually find it easier to plan their day, plan their insulin, etc. So for type 1, it may have made things easier. I think people with type 2, particularly those who are trying to lose weight, I think it's much more difficult.
And I suppose the worst scenario, and one that is not that uncommon, is that people are actually living on their own. They are feeling pretty isolated. They have this condition. Let's just talk about type 2 diabetes to start with. They have this type 2 diabetes. They know that there are lots of constraints and lots of routines that they have to follow in order to get good control. But there they are on their own. I saw a lovely advert on the telly yesterday, and the man was saying, well, there are two, he used to do yoga, but there are two great things about sorting out your own yoga and doing it yourself from a book rather than going to a class. One is that you can do it exactly when you want to do it. and the other is that you don't have to do it at all. And I think type 2 diabetes, people with type 2 diabetes may often find themselves in that position where they feel sort of that they've lost all the all the fixed points in their life regarding diabetes, like clinics and things, and they're just sort of fighting it on their own with some obvious and very severe consequences.
So I think virtual consultations, and you're right, there are far more of them, and I think it's very likely that there will be more of them in the future. I think it's particularly difficult um, for people talking to people with mental health issues and vice versa. The conversation is not as easy remotely. I'm well aware that many psychologists function and have done for a long time by talking to people remotely because of distances involved and so on. But I do think that's different because when as a when you're talking to somebody with diabetes, there is an assumption that the conversation will be about diabetes predominantly. Whereas if for somebody with a mental health problem that they want to discuss with a psychologist if they join a remote consultation, they are expecting to talk about their feelings. So for the clinician talking to somebody with diabetes, it's it's more important and more difficult to make sure that you've tried to address the feelings and how people are being affected from the mental health aspect, um, while also talking about the diabetes. Even if you start by saying how you're coping and at this time, which is what I always do, you do tend to get a sort of yes, I'm all right response. A bit like when you say to somebody, how are you? And they say, yes, I'm fine before, and they might not be fine at all. So I think it is more difficult to engage with people. Their main concern might not be diabetes, it might be how they're feeling, whether they're feeling depressed, etc. So it's more difficult to get to that point when you're talking to people.
Yes, I totally agree, and um, we 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 think about ourselves in consultations in a room with someone with diabetes, sometimes with a relative as well, and that closeness and intimacy is very profound, can be very profound. And in fact, there's someone with type 1 diabetes who told us that when she was driving to her clinic appointment, she would think about it and think about what she was going to say, what she wasn't going to say. And it's a very important space. And that intimacy certainly can't be carried out on screen. For instance, a third party, a parent or a spouse or a partner, can't can't be there. And even if they say nothing, as a healthcare professional, you're very aware of what that third party, how that third party is reacting, even if you don't look at them. And of course, you don't have to look at them. You can feel, the anger or the disagreement just in the space. That cannot happen on screen. So we've coined the phrase that there's an emotional disconnect on screen, which at the moment can't be can't be overcome, and it's going to be difficult to do it. Not impossible, but it's going to we're going to have to learn new skills to be able to make that very intimate connection with people and what their feelings really are on screen.